The World Health Organization has warned countries against relaxing lockdown measures too quickly. The director of Sub-Sahara region says that COVID-19 cases could start increasing rapidly after a lockdown. A number of countries have begun easing their lockdowns. This amid fears that the infections will rise. They're being urged to ensure measures are in place to mitigate against this. South Africa is implementing level 3 lockdown from Monday. For the latest update on COVID-19 on the continent, we're now joined via Skype by Dr. Mary Stevens, who's a technical officer at the WHO Regional Office for Africa. Dr. Stevens, always a pleasure to talk to you. Thanks so much indeed for joining us.
Thank you for having me, and good evening to your viewers.
All right, Dr. Stevens, every time I speak to you, you speak with a good level of optimism in terms of how the continent is fighting and managing the pandemic. As the numbers start to rise in a number of countries, are you still optimistic that we are on top of it?
Yes, the outbreak on the continent continues to evolve. We still have a number of countries that are reporting cases daily, and also some countries that have not reported cases for the past 1 month. So the situation is different from country to country. So as a result of that, countries are employing, of course, different measures to slow down the progression. But overall, the outbreak has been slowed down by the measures that countries have implemented, because without those measures, we would have seen much more higher numbers than what we are seeing currently. So basically, we need to continue to implement these measures in a sustained manner. The ability to detect these cases, test the cases, isolate and treat the confirmed cases, including monitoring all the contacts for 14 days. So basically, the countries would have to continue to sustain these measures, especially countries that are still reporting increasing number of cases daily.
All right. So going forwards, last time we spoke, I think we talked about coordinated efforts, but then you hear stories about certain countries like Tanzania, for example, that are perhaps not playing the game in the same way. How, as a continent, are we able to bring everyone into the fold?
So yes, for the COVID response, as a continent, we need to be together.
Hello, Dr. Stevens, are you still there? Dr. Stevens? All right, it looks like the connection has dropped there to Dr. Stevens. We'll try again in a short while, but let's take a quick break, and when we come back, we'll continue with that conversation.